Hello, Governing Board members. Jeannie Favela here. I'm going to present to you some information about Sunnyside's health and wellness policy. This is on the agenda for the board meeting on September 27th, and I wanted to give you some background about some of the requirements of the USDA's final rule. So let's get started. As we move through the slides, I wanted to provide some background information. We've had health and wellness policies in place for quite a number of years. If you notice on the legislative background, in 2004, LEAs were required, LEAs being local education agencies, to establish wellness policies by 2006 because of the reauthorization of that particular act of nutrition program for women, infants, and children. In 2010, we started hearing about the Healthy, Hunger-Free Kids Act, and this is what has continued to influence the various iterations of these requirements for health and wellness policies. In 2010, this required LEAs who were participating in the National School Lunch Program or had school lunch breakfast programs to develop wellness policies. And as you know, Sunnyside, we've had a pretty substantial wellness policy and made some strides over the years, especially because of the help of our recent PEP grant that ended. We were able to obtain a great deal of training, resources, and equipment that really brought some greater awareness of the importance of health and wellness, both in nutrition and in physical activity. So according to the legislative background, 99% of students in public schools were enrolled in a district that had a wellness policy by the time 2010-2011 rolled around. So the Healthy, Hunger-Free Kids Act expands the requirements. They continue to expand for local wellness policies, and especially in this one coming up, they place more emphasis on policy implementation as well as periodic review by the state and required updates that districts are supposed to provide. So as we move along, the final rule, which is what we're operating under right now, is the 2016 final rule by the U.S. Department of Agriculture, USDA, Food and Nutrition Services. So these are the requirements we're starting to work on. That's why we're bringing these up right now, because we have a deadline when these have to be in place. So under these new, under this final rule, it also expands the requirements to strengthen our policies and to increase the transparency, to really get it out to the public and to parents, and to allow for greater participation in our district wellness committee. So we have to have a revised local policy during this 2016-2017 year, and that's why we're working on this. Right now, what's coming to you at the board meeting on the 27th will simply be the first reading. The policy has been formatted to look like our other policies, and this particular policy, JL, which is student wellness, will replace the old policy and all of the other exhibits that we have. You'll find that the one that we're using is very comprehensive and follows best practices for the Alliance for Healthier Generations. We use their model template for our policy. So the requirements, I'm going to go through the requirements of what this USDA final rule requires of local wellness policy. The first one is wellness policy leadership, and we've had this. We just want to really step it up now and revisit and make sure that we re-energize our district wellness committee. We have to designate one or more LEA officials to ensure that each school is in compliance with this local wellness policy. And so in the first reading, you're going to see that we've identified John Oakley and me and we give our position titles as the LEA or school official responsible for the general oversight of this local wellness policy. Doesn't mean that we're going to do it all. Obviously, we're going to have a team. We have wellness coordinators in each school, but we really want to bring it back. I think with so many new people on board that we really want to, at one of the administrators' meetings, talk about these requirements and really talk about all the other things that we're already doing. So many of these things are not new, even though the requirements in this final rule are marked as new. We really have been working on this. We just need to step it up a little bit stronger. We also are required to have public involvement. We have to make sure that we have groups participate in the development, implementation, review, and the updates of the wellness policy. On our district wellness committee, we're recruiting parents. We want to have a way to bring students in. Even it's hard to get them in during the school day. We're trying to have our meetings from 4 to 5 in the afternoon so that we can invite parents and students and other representatives across the school districts like PE teachers, the nurses, any governing board members, school administrators, or general public. So we have that coming up. The requirements for policy content, we have, the first one is for nutrition promotion and education. We've always had education as part of our goals in our PEP grant. That was a major goal, that we wanted to make sure that students and staff received information and education on nutrition, but we really want to make sure that we are promoting the value of good nutrition, not only in school, but all the time. You're hearing more about gardens and garden to table kinds of things, and so we really want to make sure that we are promoting and messaging this importance of nutrition, of good nutrition. There are standards and nutrition guidelines for all the foods and beverages that are sold to students on campus during the school day. That's very important. You're going to see this in the policy, that the school day is defined as 12 midnight to 30 minutes after the last bell at the end of the school day. So during that period of time, anything that is sold to students, whether it be competitive food sales or whatever is sold through the food service on the carts or whatever, have to be in compliance with the standards and nutrition guidelines set out by the USDA. And there is a healthy snacks, smart snacks and school standards. And so anything that is used on school grounds but not sold, if they're provided to students, let's say there happens to be some kind of classroom celebration, or they have snacks for students or incentives, even though we really don't want to get students in the mode of being rewarded all the time with food, but that if there are certain incentives, that these also have to be in alignment with these nutrition guidelines. So you can imagine all the things that we shouldn't be feeding students during the day. Our wellness policies have to be consistent with meal pattern regulations, that food service is under a great number of regulations that they have to follow in order to comply with these smart snacks. They've been working with these all along, and Mr. Oakley and I and several members of our team, Jennifer Reeves, who's been instrumental in helping us with a lot of these procedures. We have sat with this policy for quite a while now. In the end of last year, when Mr. Oakley presented to the governing board, we had already made a first draft of this policy that you're going to read in its draft. It's still in draft form because it will not be out there. It will not be adopted by the school board. We will not request adoption until we've had a chance to meet with our district wellness team, put it on the website, to have feedback from the public and the community, and to also have some kind of a public hearing about this wellness policy. So it's quite a big deal that it's involved before we actually get it to adoption. So again, we have to make sure that policies for food and beverage sales, sometimes we have fundraisers or that we have anything on campus, they must permit the marketing of only those foods. And you notice marketing, we can't be promoting any foods that are not consistent with the smart snack standards. This is actually in the requirement now that the USDA final rule put out. These standards do not apply, however, to sales that take place at events outside of the school hours. So not between midnight to 30 minutes after the last bell at the end of the school day. For example, at football games or evening events, these requirements will not be put into place. So if students are selling anything like candy sales, or if there are concessions, the famous burritos at the football games, those are not going to be disallowed because of these requirements. So because those are not considered to be during the school day. I also want to make a point. I'm going to just go back for just a second that we really are looking and working with the principals to make sure that the snack machines on the campuses must be locked during those hours, during the school day. So students should not be able to go to the snack vending machines and be able to pull out snacks, unless, of course, those snacks were consistent with smart snacks, which they more than likely are not. We really need to make sure that those vending machines are locked. So moving on to the next slide, the policy, the requirements from the USDA also say that the district's wellness policies should include strategies that have been evaluated, they've been studied and peer reviewed. And so the good thing is that we have received a great number of resources and links that I will share also along the way, where schools and governing board members, administrators can access lots of ideas for how to implement these, many of which are not expensive. They don't require a great number of things that kids have to have equipment. While it's wonderful to have equipment, many of these things are not very expensive and are consistent with some of the things that have been tried. One of the examples is the smarter lunchroom movement. If you there's a website there that you can look at, but some of the things, and Mr. Oakley and Jennifer Reeves worked on this a little bit in some of the schools to make even the lunch line look more appealing, for creative names for fruit and vegetable targeted entrees. You place the unflavored milk, for example, in front of the other beverage choices. If there's happens to be chocolate milk, well, we want kids to be able to have it, to limit the chocolate milk or anything like that, but to really have the unflavored milk be in the front of the other beverages. And then in the grab and go, that they bundle fruits and vegetables in that as much as possible. And I know that there have been some concerns voiced with some parents about the fruit being too large and little kids not able to peel the orange, for example. So we'll continue to work with ways to increase consumption of those healthy meal choices, even in the grab and go venue. So another requirement of the policy is physical activity, and we have come a long way with physical activity. And while it's still challenging because of the challenges of the school day and the curriculum that has to be provided during the day, that students, we still really need to make sure that we're including in our plans how we're going to allow for physical activity, and include goals for other school-based activities that aren't during the school day, before school, after school, walking clubs, where kids can meet at a school and walk down the street together almost as a team. So there's different ways. It's getting the group to really think out of the box for ways to incorporate this. So physical activity is going to be a big requirement. Along with this, we have record keeping. So we're required to make sure that we have, of course, our written local wellness policy, that everybody has access to it. It's on the website. It's being translated as we speak. And so people can access it. and that people know what it's about, and we continue to just talk about it. I think that's one of the main things we have to do, is just keep the awareness going. We don't expect that people are never ever going to eat anything that's not on the smart snacks, but that if we really promote it, that kids will be more likely to try and maybe enjoy things like fruits and vegetables. So that's what we're really doing. We have to also document that we are in compliance. We have to demonstrate that we're in compliance with the community involvement piece. And so when I sent out the draft policy, I sent it out to everyone in the district, all the sites and administrators, to nurses, but also to Pima County Health Department, to our colleagues at the university, and we'll continue to send it out to different organizations, Community Food Bank, all our different people that can join us in our meetings, and if they can't come to the meetings, at least to provide some input through the website and how we can make this policy better. Another thing is that the state is also going to, every 3 years, a triennial assessment. We will be having compliance checks by the state to make sure that we are doing what we need to do to follow our own policy. So we don't want to just put it in place and then forget about it. We really want to make sure that it's a living document and that we're all on the path to be healthier human beings by more physical exercise and eating better, having rest, proper hydration, things like that. So we all could stand to do more of that. And we also have to document, we have a website that will also bring it at a public hearing of some sort, so that we'll talk with the superintendent and who will discuss with governing board members what the best time to do that. I don't suspect that the policy will actually be fully adopted until second semester, because it requires various steps before we get to full adoption. And then, like I said, this will become our policy JL, student wellness. Again, informing the public. We have to inform them about the content and the implementation of the local wellness policy. This is very, as I said before, because this particular iteration of the requirements want school districts to really be transparent and informing the public and bringing the public into what we're doing, so that we share this not only at sites but in the community. And then the updates that we make to the policy, we have to make them available on an annual basis, because we may add some things, revise the policy. They always have to be changed up sometimes, and we will make sure that the public is aware. Like I said, state oversight. A state agency. We have a department at the ADE that will examine records during the administrative review. We are part of the Empowerment Schools group through the Arizona Department of Education, and we get occasional visits by Matt Leversey, and there are different things that we have had to do. There are surveys that they've asked schools to complete. We've also received through this empowerment grant $4,000 each year for the last 2 years. We're going to be using that money for the schools, divvy it up across the schools, perhaps by enrollment, so that they can use it to do things like wellness weeks and activities that they can promote their health and wellness. We'll use those monies in the pursuit of really promoting this plan, showing parents what it can look like in a school when we're really trying to be healthier. The results of these examination periods that the state comes in for have to be made available to the public. And these assessments will determine our compliance with the plan, with our local wellness plan, and how our plan compares to model local wellness plans. If we have the gold standard, for example, if that's what we're shooting for, how are we in comparison to that? Where do we need to beef things up, no pun intended, to make our plan stronger? And what is our progress made in attaining these goals? So we don't want to just remain static, but we want to continue to grow. And just again, we're going to update as appropriate. Okay, so the LEAs, school districts, again, need to provide a copy or appropriate web address. We're really on board with that. Already spoke with Mary Veris, and we're on board to put the draft up as soon as the translation is complete. Sally Ray is working on that, and we'll get that on the website. And also, I'd like to send something out. Maybe similar to the Sunnyside story where we do something online, but that it's a kind of a health and wellness newsletter like we used to do when we had the PEP grant. I think those are very uh, helpful because they also provide links to resources where people can just go online and say, hey, that's a great idea for something we can do in the classroom. We have a great number of resources, the Let's Move videos, things that online that classrooms can use when they're taking a 10 or 15-minute break in the classroom, that they have different things that students can walk in place, use stretch bands, or find all different ways to get up out of their seat and have some movement. We want to showcase that. We want to make sure that just like we showcase many of the wonderful things that Sunnyside is doing, we want to showcase our health and wellness efforts. LEAs must describe who is involved in reviewing and updating the local wellness policy. In the draft of the policy, you'll see only a few people who are on our district wellness committee, but we are meeting on October 26th, and we will invite people to actually become part of that, and we will share the additional members of our district wellness committee. As you will see later in this presentation, each site is supposed to have a school health advisory council or a shack, what they call, and that they have a wellness coordinator, but they also have a team that looks at these kinds of things, or what is the school doing to promote health and wellness, nutrition, promotion, education, and physical activity. So we have to demonstrate how we're having making aware potential stakeholders to participate not only in the development but in the review and the implementation. That's the key, is the implementation of this local wellness policy. We want to provide the most recent assessments, and just like I said before, those are just specific requirements. There are many requirements, but again, we're doing many of these things already. They want us to be more transparent and more rigorous in how we promote nutrition and physical education. So these LEAs, which are us, all school districts, we need to comply with all of these requirements by June 30th of 2017. That's why we're starting now to really go through all the pieces. And so we continue to talk about it. At the next all administrator meeting, which is on October 6th, this will be a topic to make sure that principals are aware of these requirements. And again, this won't be a big surprise because much of this has already been done. Again, the challenge is making sure that we're getting kids to have enough physical activity. Certainly PE for elementary students, that's 30 minutes a week, but we know that that's not really all the kids need. We're making it pretty loose. We're saying that it should be 90 minutes a week, so that can include PE, and it can also include 60 minutes that's required for elementary students of some kind of structured activity, which is, it doesn't have to be outside, all the time. Structured recess is difficult to implement because you need to have people out with the smaller group so that to make sure that all the kids are in a structured activity. If these structured activities can be incorporated into lunch recess, that's certainly fine as well. So we're making sure that we're telling schools that 60 minutes, aside from the 30 minutes of PE, we want 60 minutes of some kind of structured activity, whether it be inside or outside. So if you take 60 minutes a week of physical activity and divide that by 5, that's only 12 minutes a day. That doesn't have to be every single day, but maybe it could be 3 times a week for 20 minutes, or during the school day, if it's not possible to be outside, that they could have little 10-minute periods. We don't want less than 10 minutes. We want the kids' heart rate at least to move a little bit. So we want them to make sure that they have no less than 10-minute sessions, and they can do maybe one in the morning, one in the afternoon. So there's lots of different ways, or in between classes, kids can walk and stretch and move their feet and do leg lifts or whatever it is that the schools can do. While it's challenging, I understand, and that's our greatest challenge, I think, there's only a finite number of minutes during the school day, but what we want are kids that really are used to physical activity, and we see more and more on the long-term effects of good physical activity of daily. Our bodies were meant to move, and we all need to make sure that we have a less sedentary lifestyle. So this, again, the Sunnyside Health and Wellness Policy, what I just want to share with you, as you recall, we had meetings with district and community leadership to develop the first drafts. That's already been in place. We started that last spring. The draft was included when Mr. Oakley presented last year to the governing board, and he also was required to show the first draft during his audit of the food service. So we made sure that we had at least the first draft completed for them to review, and it was previewed during last spring to the governing board. The final draft now is being sent again to the sites and community leaders for review. We'll have it to you for this September 27th governing board meeting. There will be no action on this, but it will simply be for you to review it and ask any questions you may have. This will be a general functions item, and I just wanted to make sure that you had this in advance so that you could also look. On your Novus item, I'm going to give you again the summary of the USDA requirements. It's a really good one-pager that gives you kind of a thumbnail of all of the requirements of this program. The draft again, and then we'll post it on the website, and we will be meeting with the District Wellness Committee. Any of the governing board members, you're welcome to come. I will let you know where. We haven't confirmed the location. It will probably be in one of our portables or in our boardroom, wherever we can find a location, but it will be from 4 to 5 in the afternoon on October 26th. So we're really excited to bring that. We've already also had feedback from Dr. Garcia from the Pima County Health Department, who said he'd be happy to be part of this. And so we really want to make sure that all of these things are in place. And when you look at the draft again of the policy JL, you will see that there are resources, and I will continue to provide links with lots of ideas of where you can get more resources, and schools can have access to this. So here's to health for all of us, and I hope this little preview was helpful to you, and we'll see you at the board meeting. Bye-bye.